Welcome to the OncoPT podcast, where you'll learn from oncology experts, practitioners, and patients to help you on your journey to become a confident and competent OncoPT. Here's your host, Elise Cantu.
Hey there, OncoPT, and welcome to this episode of the OncoPT podcast. This episode is going to be the first part in a series of episodes that we are doing where we're talking about the process of professional growth. And hold up, okay, we're not talking about professionalism, okay? I think that has a certain connotation with it. We're not talking about that. We are talking about your professional growth and specialization, ultimately leading up to the ABPTS Oncology Specialty Certification Exam. And the whole reason that this conversation kind of sparked in my brain. So this past weekend, I went to the annual Cowtown Oncology Nursing Symposium here in Fort Worth, Texas. This is a conference that I've been to for several years. This is a conference I've talked about on the OncoPT podcast. And for the first time, I actually dragged along another physical therapist to come with me to this conference. And it was really eye-opening. First of all, for Tori, who you know and love on the podcast, to, have this experience, to make these connections. I'm putting this out into the universe. I'm hoping to get her on the podcast to talk about this experience as well. But it really started the gears turning in my brain about how dissatisfied I was with the fact that there were two of us in the audience who are in rehab, who are working with oncology patients in this capacity. We are, as far as I know, the only two specialists in Fort Worth, Texas, who are treating oncology patients. And the fact that you may or may not know this, Fort Worth is not like a small little podunk town. Sometimes I feel like that. It's actually really big. It's technically either the 12th or the 13th largest city in the entire United States. So we're not in this like little town. This is a big city. This is a big city where a lot of people live. And a lot of people come from out of town actually into the city for various purposes, including their healthcare. And this dissatisfaction was really growing within me as far as we have this tremendous population in our city and in the surrounding areas and in the far-reaching areas where people come in. And there are literally two, at the time of this recording, board-certified clinical specialists in oncology physical therapy. And that's not good enough. I know we have a third, okay? I have talked to this, to-be third person, and hopefully there's more to come. But the fact that we are now in 2025 and there are still only two of us, for being the 12th or 13th largest city in the United States, I'm not tolerating it anymore. Like, I am unaccepting of this, and I reject that this is our reality. Like, it lit a fire in me. This is not good enough. This is not good enough. This pace at which we are, adding to our what am I trying to say here? Not inventory. That's such a terrible word to use here. The pool of specialty trained physical therapists who can confidently, competently treat oncology patients, it's not fast enough. It's not good enough. And I really had this mentality for a long time of, we add about, I think it depends on the year, but anywhere from like 30 to maybe 60 new specialists a year. And don't quote me on those numbers, okay? That's what I'm remembering in years past. And it's like, that's kind of the speed at which we do things. And that's just how it is. And I realized this past week, no lie, that this mentality comes from a place of scarcity on my own part of like, well, that's just how things are. That's just, this is just what we got to work with. This is just the reality. And I was literally driving to work the other day and I was at a stop sign about to turn onto the main road to head down to my clinic. And I realized it does not have to be that way. Not just like, it doesn't have to be that way. It really doesn't have to be that way. It was I can change this. We can change this. And how we change this is not by accepting of like, well, that's just how things are. That's just how we do things here in oncology. We're slow and we're small, but we're mighty. No, we can be big. We can be really big, in fact. The way that, ortho is really big, that neuro is really big. I have a scarcity mindset of my own of like, that's just ortho and that's just neuro and, all the other wonderful academies out there, they're just really big because that's the bulk of PT. Friend, and like I talk about this on the podcast. I talk to other PTs and professionals who are in this world who are, not just in onc, but in all these other places treating patients. Oncology is throughout every patient population, every setting, every institution, every quote specialization that we think we are in. Oncology is there. Cancer is there. People with cancer are there. And so this mindset that I have been having, and I think that we sometimes as a profession have of, we're just slowly adding to the pile of available practitioners, and we're going to get there someday. We're going to get there someday. But we just have to wait for that to happen. I'm not sitting for that anymore. I'm not allowing that anymore. And I have realized I have had a fundamental shift this week in I am going to change this. And you and I are going to work together to change this because this is not good enough. I have an urgency in which I am now proceeding with this. I have a fire under me that we can make it. We can make it so that there are more specialty trained clinicians who are confidently and competently going to step up to the plate and say that I can and I will and I must treat these patients with cancer in my community. Because the amount of patients who are falling through the cracks, who are not getting connected with necessary life-saving, life-restoring cancer rehab services is not good enough. We've been playing small for far too long. I've been playing small for far too long. It's go time. And so all of this realization, like I said, I'm literally sitting at this oncology nursing symposium conference that I love going to every year. And I'm just like, I'm not getting angry with the speakers or with the content. I'm getting angry at the reality that is such. And as I'm getting more and more mad at the reality, it wasn't until that few days later when I was driving to my clinic and I realized, oh, that doesn't have to be the reality. And in order to make that not a reality, it has to start with me. It has to start with each of us, okay? In our own journey. This is my journey right now. It has to start with me getting out there and making it so that there are more clinicians who are skilled and ready to step up to the plate and treat this patient population. And that is why that has really shifted this big why for me of why your expertise, why advancing your career and advancing your expertise is so, so important, especially within oncology, physical therapy and oncology rehab. One of the things we also talked about at the conference, there were many, many things, was just how rapidly things are advancing. Like we talked about different screening tools that are being used to detect cancer earlier, talking about different tools to identify different markers on tumors so that we can get more targeted with our therapy and determine who is likely to have a recurrence versus a full response to treatment. All these things. So there were a lot of updates that I was learning about from the medical side of things at this oncology nursing symposium. And it really, like I said, lots of gears, lots of wheels are turning in my brain, which is so exciting. But it really highlighted just how quickly oncology as a field is developing, is evolving. And therefore, cancer rehab, oncology rehab needs to be developing and evolving just as quickly, if not more, because we are behind. We are behind in all of this. And so being at the forefront of our field requires us to commit each and every day to learning and to bettering ourselves and bettering our profession in order to better care for our patients. If you're going to be the best possible OncoPT that you can be, if you're going to be the best physical therapist you can be to treat the person with cancer in front of you, you cannot just be reacting to the changes. Like I was at this conference of like, wow, all this new information that I'm learning. I should really I should really learn about this and implement it into my practice. No, I need to be out seeking this information to then better inform my practice. If we are going to actively shape the future of cancer rehab and how our patients should expect to be cared for when they hear the words, you have cancer, we have to stay informed. We have to be constantly refining our clinical skills and continuously pushing for better patient outcomes. And when you take the steps to deepen your expertise, you're not just improving your own knowledge, you're also contributing back to the field. And it's not just a feel good, like, oh, I'm giving back, I feel good about this. It is, you are changing how we inherently practice as physical therapists, as rehab professionals, so that we are then elevating that standard of cancer care that I was just talking about here. The more confident, the more competent you're going to be to address challenging patient cases, right? When a patient comes through your door and you're like, oh my God, I have no idea what this is, because it will happen if it hasn't already, and it's probably going to happen multiple times, you're better able to cope with this and to address these impairments and ultimately get the patient to where they are wanting to go, where they are needing to go with their functional mobility, etc. Beyond just the being better able to show up for your patients who are coming to you for skilled, expert level cancer rehab services, developing and deepening your expertise gives you a stronger voice within the oncology rehab community, where you can advocate more effectively for your profession, for your patients, but also within our profession and within the medical field, so that not only are we working to advance cancer rehab again for the individual patients that we are working with, but we're also making those connections back and forth as an interdisciplinary team to really put the patient at the center of what we're doing, to support them and to ensure best possible outcomes in every facet, in every department, in every domain of that person's life. So however you choose to deepen and expand your expertise, amazing. I love that. For me, I have found that the fastest way for me to do that, and for my colleagues and other physical therapists that I work with and mentor in this space, is through clinical specialization. I'm a huge advocate of it. I have seen how it has impacted my own practice, how it has impacted my own community, and beyond me, right? Across the United States. I'm seeing how this is impacting cancer care, and I believe in it fervently because of this. There's other ways, right? But the role of specialty certification is one of the most structured ways by which you can develop and then showcase your expertise, which is why I'm such a big believer in it. Now, I did not know, genuinely, a whole lot about board certification when I graduated PT school. I had professors who were board certified in their, specialty, whatever that was. We had a very brief conversation in PT school where I think one of the residents, like a neuro resident, came in and then talked about, like, they had the kind of panel discussion, now that I'm thinking about it. Because they had the neuro resident, they had one of the professors who was part of a fellowship program, and a couple other people who were like, part of that higher certification education, continuing your educational journey after graduating from PT school. And I really tuned it out, to be perfectly honest. A couple reasons. I knew I wanted to do oncology. I didn't know about oncology specialty certification at the time, because it actually wasn't a thing. At least at the time, as far as I knew of this panel discussion. And number two, I was extremely privileged that I started preschool and went all the way through elementary school, middle school, high school, college, and then straight into PT school. I was schooled out. I was done. I was ready to frankly work and earn money and not have to study things for a little bit. Joke was on me because I did have to study still when I started working, but that's a different story for a different day, right? We live and we learn. And so I really didn't think that board certification was for me. I didn't know about it. Oncology wasn't a thing. And it wasn't until I went to my very last clinical rotation as a student, right before I graduated from PT school, where I had an amazing oncology experience with my clinical instructor, Dr. Shruti Manvi, who also presented at CSM this past year. And she told me, she said, Elise, you need to do this board, like you need to take the ABPTS oncology exam. At the time, she was preparing for it along with a few other PTs kind of in that healthcare system in the DFW area. And so they were really pivotal for me in seeing, oh, this is a thing. Oh, this is like a really important thing. This is a useful thing. This is going to help me get to where I'm trying to go. Because one of the things that I have always wanted and I'm continuing to work on in my own life is I want to bring the highest quality of cancer rehab to Fort Worth. Like that is my thing. I knew when I was in PT school, I always wanted to come back to Fort Worth. I knew that once I was introduced to oncology, I wanted to bring that level of cancer rehab to Fort Worth. And I was told actually in PT school and, at conferences that I would go to as a student of like, if you want to do oncology, you got to go to New York. You got to go to Houston. And I said, no, I want to come home to Fort Worth. I want to work in Fort Worth. I want to work alongside my people here in Fort Worth. And I want to bring oncology rehab to Fort Worth. That has always been my goal. And I recognize, because Shruti poured this into me, that the way I was going to make this happen, achieve this goal that I'm continuing to work on to this day, is through board certification. Now, the exam, as I came to find out, was just part of the process. The ABPTS Oncology Specialty Certification exam is more than just a test. It is a powerful tool, for really distinguishing yourself and the level of knowledge and expertise that you have curated and developed as a commitment to your deeper understanding of oncology rehabilitation. So this isn't just a I'm better. This isn't I'm better than everybody else. This is a commitment ultimately to yourself and to your patients that you are diving deep into the field of oncology rehab to say, I am going to understand this better and show up better for my patients in my community, to elevate the standard of cancer rehabilitation for every single person, not only that I encounter in my own practice, but in my neighborhood, in my community, in my city, in my state, et cetera, et cetera, et cetera. Now, again, the exam is not the only way that you can grow as a clinician. You don't need a board certification to be an amazing physical therapist. But as I've mentioned before, specialty certification provides a structured, clear pathway by which you can professionally develop yourself and push yourself to expand your expertise in a way that is going to benefit your clinical practice and your patients, and frankly, our profession, which needs it. So if you are looking for a tangible way in order to solidify your knowledge, to challenge yourself, and to accomplish these big cancer rehab goals that I know you have, board certification is an excellent step forward. Now, as you are going through this process, if you are like, Elise, I'm interested. I'm curious about this. I think I'm ready to take this next step and start to explore this board certification that I keep hearing about, that I think is, maybe the next step for me. Preparing for the exam is not just about passing a test. And this is something that I wish I knew a little early on in the process. This process by which you prepare for the exam makes you become a more knowledgeable, a more confident, and a more effective and a more competent clinician for your patients. This process really pushes you to keep up with the latest and greatest in research, which is what we should be doing as I mentioned earlier in this episode about all the updates that we were learning about at the Cowtown Oncology Nursing Symposium, right? So making sure that we're staying abreast of the latest and greatest in oncology research, but to also refine your clinical decision making. And this is probably the area that I grew the most in as I was preparing for my board specialty certification exam. And so that for me, because when I finished PT school, I started practicing within an oncology setting, and it was trial by fire. Like, even with as much preparation as Shruti and the others poured into me, I still don't think that I would have been prepared for then moving into an oncology setting where I was working by myself, seeing patients who frankly were just a little different than what I was seeing at my other, my clinical rotation, right? Also, I was working as a big PT, right? I was graduated. I was a licensed professional. There were things that I was learning so rapidly, and I was still very I was kind of like floating. I was a little awash almost when it came to making really confident clinical decisions on, like, I think this would help my patient, but I'm not sure if this would help my patient more than this approach over here. And when I dove into preparing for my specialty certification exam, that really solidified for me. And I felt that as I was going through the information, I was remembering different clinical cases and different decisions that I had clinically made for my patients, that I could then say, that was a good decision. That was the right decision in that moment. Or I also had a lot of, that was not the right decision. And this is not to make you feel bad. Okay. It's here's how I will do that better for the next patient that I encounter who has a similar presentation, who has similar circumstances, right? Many PTs who study for the oncology specialty certification exam notice that immediate shift in their practice as well. You are going to approach patient evaluations with more precision. That for me, game changer. Like, when my evals went from being an hour plus to I can get in, I can get the most crucial information, and I can already formulate the best plan and then start implementing that with my patients on that first session, game changer. Not just for the amount of like mental work that I had to do, but also for really establishing that therapeutic alliance with patients. Boom, game changer for me. This process also helps you identify impairments that you may have overlooked previously without immersing yourself in this knowledge, in this research, right? And you feel more equipped to address your patient's needs appropriately within this greater healthcare system that we work within. This process is going to challenge you in the best way. It's challenging. It's a challenge for a reason, right? But it is going to challenge you to think critically, to integrate evidence into your practice more intentionally, and to also build the kind of expertise that you and your patients have been seeking within your own community. That is really going to set you apart as an oncology specialist that our patients so desperately need. When you commit to this journey, you're not just preparing for an exam, although that is definitely part of the process, right? You are investing in yourself, in your growth, in your career, but most importantly, you are investing back into your community and into your patients who need and deserve the highest level of cancer rehab that you can provide for them. Now, this is usually where I get pushback from people who are like, I don't know if this is for me. Maybe you're thinking to yourself, I don't have enough experience for this. I'm not yet an oncology expert to where I feel I can sit for this exam. Many PTs feel this way, but you are likely more prepared than you think. And I will talk about that actually more in our episode that is coming out next week. That is going to be part 2 of this arc that we are doing. You may think to yourself, I'm too busy. I have too much going on right now. I cannot possibly commit to another thing. I hear you, friend. Life is hectic. Work is crazy, but professional growth is a long-term investment. And I personally found that, yes, I put a lot of time into preparing for this exam, 100%. There is no doubt about that. But the time that I'm now getting back, because I didn't have to I struggled through the first 2 years of my practice. Absolutely. But the time that I now get back, because I'm not struggling with things like I used to, that I know where to find help and information because of the skills and the knowledge and the expertise that I gained, is absolutely making my life, my career, my practice easier. And I will also share more strategies with you on how to make preparing for this exam manageable within your own life, within your own set of circumstances. So stay tuned for those, my friend. And then the last kind of misconception, or maybe, barrier that PTs butt up against is, will this really help me? Is this really beneficial? Is this yet another, sometimes you take continuing education courses and you get a certificate at the end and you're like, I don't know if this was really helpful, or if this is just like another set of letters after my name or whatever. This is by and large one of the most impactful things that I have done in my career for my patients in my community. And I see this happen again and again and again in the physical therapists that I mentor and teach through this process. This certification can enhance your credibility. It can lead to career advancements, and it sets you apart in a growing field. And frankly, also helps this field grow bigger faster, which is really what I talked about at the beginning of this episode. I think one of the best examples of this is our friend Scott Capozza. Scott Capozza is a physical therapist up in Connecticut, and he has talked multiple times about how when he went through the process of becoming a specialist, and then went through the exam, ultimately passed the exam, having that board certification after his name really helped, him not only feel confident in what he was doing, but what really made an impact is that he had physicians and other key players within oncology who recognized that, like the board certification on like a business card or an email, and said, oh, we need this. They, even if sometimes we encounter different, professionals in our field who maybe don't understand what cancer rehab is, but one thing that they do speak is they recognize board certification. Oh, that's a big deal. That means you know your stuff. In that case, I want you on my team. I want you working with me. I want you working with my patients. And that is, I'm going to have Scott back on the podcast to talk about this, because this is absolutely one of the biggest things. Again, it may not open all the doors that you need it to, but it can open the few doors that can help you make a really big difference, that can help you get connected with people who can open up those other doors that you're trying to break through. So if you are committed to advancing your career as an OncoPT and all the goals that you have, and thinking about how can I make a better world for my patients in my community who are diagnosed with cancer, I want you to take a moment to reflect on what growth looks like for you. What skills do you want to refine? What knowledge gaps do you want to fill, to close? And most importantly, what impact do you want to make for your patients, your profession, and for yourself? Pursuing board certification is a powerful way to take your expertise to that next level. And the first step in all of that is deciding to go for it, to do it. In next week's episode, we are going to break down the application process, what's required, what are the deadlines, and how to set yourself up for success. So if you were thinking earlier, I don't know how I'm going to fit this into my busy life, this episode is going to help you do that. Now, if this episode resonated with you, I would really appreciate it if you would rate this in your podcast player as 5 stars. It helps the podcast get out to more people. And if you've already done that, I would really love for you to share this episode with a buddy, with a colleague, with a bestie, in oncology rehab who needs to hear this information. Maybe should also consider board certification for their own selves, right? Doing this together is how we are going to raise the standard of cancer rehab and for oncology care for our patients in our communities. Now, if you are already like, Elise, I am sold, let's go. If this is you, if you're feeling inspired to take the next steps towards board certification, I have a free resource to help you get started. So you can actually register for our free workshop, the 3-step framework for a finished case report, where I will walk you through exactly what is required for your case report to be accepted. That is part of the application process. Don't worry, we'll talk about that next week. I got you, friend. But if you were like, let's go yesterday, this is what I want you to do. Sign up now for this free masterclass at theoncopt.com/framework, FRAMEWORK. I can spell very good. And let's get your application on the right track. Until next time, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.
Thank you so much for listening to this episode of the OncoPT podcast. If you'd like to help support the podcast, please share it with others, leave a rating and review, or support us on Patreon.